Hi, Bhanu. How are you?
Hi, ma'am. Fine, fine. How are you, ma'am?
Yes, I'm fine. It's been a long time we met each other.
Yes, me too. After a long time, we are in again into a session.
Yes, yes,
So, it was a wonderful to conduct this because, as in part of promotion of our Hyderabad seminar, we are conducting this case discussion series.
yes.
So, the
I'm so
seminar is on
grateful to be a part
25th
of this.
August.
Mhm.
Oh, thank you, madam. So, it's on August 25th, and the topic is the money that matters. So, where sir going to discuss about many shades of remedies regarding the money matters. So, apart from this seminar, so as a student, you are regular attending the sir's clinic and Gurukul also, and you are learning since long many years. So, what was your experience? So, how the teachings of sir has helped you?
Actually, first thing I want to convey is I'm so thankful to be a part of this. How SARS teaching helped me is I started journey with SARS teaching from my college days, from my third year itself. So before when I
Mm.
was in first year and second year, after completing what I am going to do, after completing homeopathy, what I am going to do, because I don't have any guidance or I didn't got any route and I didn't got any plans to how to go about with homeopathy. But after attending SAS seminars, I decided that this is my path and I want to follow SAS teaching. What inspired me in SAS teaching is SAR's way of explaining things in an easy, understandable way, and SAR's way of taking the case and analysis of the case and bringing the holistic cure to the patient help, helped me and made me to stand in this path persistently. Then second thing, not only SAS teaching helped me in clinical aspect, but also helped me to develop as my inner. I'm whom I am now is only because of SARS teaching. I can say I have developed itself in many ways
Okay.
as an individual only because of SARS teaching. So this is how my journey was.
We can agree because yes, that we can agree because all of who are listen sir's lecture or who follows sir will agree with this thought of inspiration of the sir. So how this teaching helped you clinically in your cases? Any of such cases where the patient is talking about any money matters or the financial issues. So how you went in that aspect of the case? So what is your idea on that? Before going that, any idea?
Yes. When the topic comes to money, we can see everybody will go enter into mineral kingdom. As we all know, we have remedies from materia medica in three kingdoms majorly,
Mm.
from plant kingdoms, from
Correct,
mineral kingdom, and from animal kingdom. So when it
correct.
comes to money, most of us will majorly enter into mineral kingdom, and that too, especially in the third row and fourth row issues. So
Yes,
whatever
yes.
I have taught, I was able to apply it in my clinic. So what I have experienced with my cases is whenever we see the third row patients talking about money, it's not directly about I need that money. So how they will talk is
Okay.
their loved ones or their parents or their closed ones, they will tell they will buy and give me things. They only know what to buy for me. In the sense, they
Correct.
are giving money to purchase that thing and they will buy and give for me. They
Mhm.
only know what food to give to me. So he will
Okay.
he will purchase and give me the food, or my mother will purchase and give me the food. So
Okay.
it is a basic issues, whatever they need. We can see in natrum group of remedies and magnesium group of remedies. So
Yes, yes, yes.
mother will give me the food. I don't know what food to eat. So she will give me. So in the third row issue, it's all about the small, small things which we spend money for that. But they will not directly
Okay.
tell. This is the indirect
Okay.
way of telling about the money. But when it comes to fourth row issue, they will tell like, I need my father's support to pay for my college fee, or I need my
Mm-hmm.
mother's support, or I need my partner's support to help me in business, to
Okay.
evolve in my business. So if my father have saved that amount, I will take that amount and I might spend for this business, or I will spend for my
Mm-hmm.
studies. So
Okay.
this is how the fourth row issue it will be.
So
So
it's all about dependency of left side. We can see natrum, magnesium on the parents, and the parents are their identity issue. So our parents gives their identity. So that's all about the third row, and the fourth row comes to that the dependency regarding their security towards what we see the in elements like Kali and Calcarea group
yes,
of remedies.
yes.
Yes, yes, correct, correct.
So Cali will be like they will be more anxious if something happens to their family members or health issue to their family members. They will be more anxious because they are the one who is
Mhm.
taking care of the family. They are the one who is spending amount for
Correct.
the groceries. So if that person falls ill, so now what I will do? There is nobody to provide that money to me. There is nobody to buy that
Mm.
groceries. There is nobody to help me in home financially. So like that, they will be completely dependent
Yes,
on the
yes.
person who is giving them financial support.
Yes, yes, yes. So we can think like this when we see one remedy Kalikar. So where patient is dependent on family for everything. So he can't recognize that he is dependent, but he is dependent on family. When certain time comes where he want to live independent after certain age, then all the struggle, searching for job, searching for home, or searching for place, or searching for some earning. So thinking about the future plannings. So then all the troubles happens because he is not exactly what he was because he is a dependent personality. Kalik Karm is a dependent personality. If he want to be independent, he can't.
Yes,
So where these ailments can be started. So we can think in that.
yes, definitely. I do agree, and I do have seen the same things in the clinical cases also. Then,
Yes,
when
yes,
it comes to Calcaria, it is like whenever they are in the difficult situations, they will think like, I have that money, but I don't know how to invest and where to invest the money. So I need the guidance of my father. Or those who
mm,
are in that state, those who have experienced the same situation, and they will guide them. Maybe in work, it might be the manager, those who guide them. So when it comes to
okay.
Calcaria,
So guidance.
yes, they need
So it
that.
is a guidance all about the who are the higher than them who already experienced that path. They seek guidance from that.
Yes.
Correct,
So they will that person will tell them where to invest, and how to start their business.
correct.
Yes. And especially when it comes to Calcaria, I have seen an interesting scandium case in clinic.
Oh, mm-hmm.
Like how scandium personality is, it's a case of vaginal candidiasis. So it's a 32 years old female case. How she was like, she had a baby of 3 years old. She narrated her physical
Okay.
complaints. After narrating her physical complaints, she said, now I am in a state and now I am confused like whether to take care of my child because child is small, or I am confused whether I should go to job and earn money so that I can support the family, so that I can be independent and I have my own money. I am confused between these two because now child 2 is in the state that she needs my support because she is only 3 years.
Hmm.
So I don't know what to do. I'm in
Oh,
between these two states. Even though my husband too is
okay.
going to work and earning, my father-in-law goes out to the farm and he will earn, and he's also having some business. But I want to earn for myself so that I can get and give my child whatever she needs, or I can support my family with my financial needs. But now I am in a state like as my child needs the support, I don't know what to do. Either whether I should not go to the job and take care of my child alone, or to go to the job. I'm confused in between these two. This is how
Oh,
that personality went. And she worked well with Scandium. There is a
oh,
confusion
very nice,
between
very
these
nice.
two.
Acha, 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 acha. So generally, Calcarea is sticking to that job
Yes.
where that before remedy, that Kali, that
Uh,
changes the job. They don't know what to choose. So they work for certain period in certain job. They will leave that job and again new job, Kalis. Where Calcarea, they will work for long period of time.
yes.
Whereas Scandium, they want to take any new job or the job, only problem. They can't decide because of that confusion. Just they want to be, the idea of want to be independent. Just it is an idea. So it makes them confusion. So it's a beautiful case. Beautiful case.
Yes.
Yes.
Yes. So have you two experienced the same things in cases, in your clinical cases, in the aspect of money?
And especially Calcarea. Generally, Calcarea persons are, they want to be secured wherever they are. They want to be secured. In jobs also, if they want to be go to higher positions, they won't go. If they have promotion, or position, they don't want. They will say, I don't want any higher position. So I will be stay at whatever the position now because they can't handle the higher positions. So they are secure with the whatever the job they are doing or the place or the position, whatever. So they secure in the form of money. So their bank balance, they see for bank balance. In this bank balance, are they spending any amount or the money? So if you ask, so if you want to take any decision, what you will do? So I take decision, doctors, especially in the money matters, because I don't know how to spend money also. So I take the support of my father or I take the support of my mother. So in this way, they will say, so tell me about that support. How, what way you will take? Because I don't know where to spend this money, which home to buy, and where to invest. So I don't know. So I will take the support of my father in these aspects, especially father support they take, so that they will guide them where to invest, how much to invest, if you invest, it is good or bad. So these all things runs in their mind. So where we can see the calcaria. So they seek for support in investing also because they have the fear of insecurity and fear of opinions of others. So that is why they take the support of family members rather than outside. outside numbers. So in this way, we can say that Calcarea, how it thinks about the financial issues, how they deals with the financial issues. So this is about my experience regarding the Calcarea group of MDs.
Yes, very true. Because they will be in their known circle where they need that safety,
Yes,
protection, because they are yet still yet to
yes,
develop from their own.
correct,
Yes, very true.
correct.
Amazing one. And we can see mostly in the rubric sphere of poverty. Calcarea group of remedies
Mhm.
also we can see. Mostly Calcarea group remedies
Yes,
covers under that. Calcarea silicata,
correct.
Calcarea salve. They have the fear of being poor or fear of being poverty. In that rubric we
Yes,
can
yes.
see
The
this.
Calcarea floor also. Yesterday, I was discussing it with Gautam also the case,
Mm.
the Calcarea floor, how the fear of poverty was there.
Yes, I do listen
So
to.
any other experience regarding this issue, or what's your experience, how you applied the teachings of Shekhar sir when it is particular to area, certain areas, any patient, how you have dealt?
Yes, when it comes to SARS teachings, I might not have what to tell. When I explain this case, you will understand. Actually, I saw a case of a headache
Mm, mm,
where the patient doesn't want to be disturbed at the time of headache, and she needs to be in absolute silence, and she needs to go to sleep. But when I explored further, she said she and her husband started one company, or like a small factory they started to run a business. So what happened? There happened
mm.
a huge loss, and the whole money was drawn out. They didn't had any money at that time.
Okay,
Husband too didn't had any job at that time. So she said that was a huge loss in her life. But I asked her, how does this affected you? This loss? She said, more than this loss, others have asked me what all has happened, what has happened to you, what has happened to their business. So when others ask, that hurted me a lot. That affected me a lot.
okay,
So it was like the money, the money also matters in this issue. But when we probe further, it has hurted her. It has affected her. Not the loss of the money, but the persons surrounding to her when they asked about this loss. So, apart
okay,
from money loss, the surrounding what has happened have affected her.
okay. So sensitive.
So she is sensitive to what others ask. So if I might not
Acha.
have attended SARS teaching, or if I might not have got the guidance from sir, I might have went into some other remedies, because they too spoke about
Yes,
financial
correct,
issue. So when we
correct.
probe further and when we applied the case taking, what SAT taught to us, we were able to get the patients into deeper level, and we were able to know what is
Mm,
the issue of the patient. And
correct.
with the exact modalities covering, I prescribed her bryonia. And with its two doses,
Oh,
it
wow,
was completely well fine. Unless and until without SARS teaching, I might not have applied this. Case taking also, and how to take the case further.
correct, correct. It's
We might think money means only we will go into plant. Sorry, we will go into minerals. But
mineral,
plant
minerals.
also will speak about the money. But when we probe deeper only, we can understand what is the issue from the patient's mouth.
Yes, yes, yes. So here we can think in this way, money, the financial issues or the money matters is separate, but when we come, few MDs talks about the business.
Yes,
Few MDs talks about the business. The business may be n number of ways. So talking like a business. Or like child, if the child want to do business, how
Yes.
much you will be giving for me? How many chocolates you will be giving? If I do homework, how many chocolates you will give? So how much
Yes.
chocolates you will giving to sister? So this is also a business talk. So when we think of this financial mindset or the money matter, it's not all about only about the money, but it comes as a business. For
Yes.
example, same Bryonia case where patient is one of my cases. Patient came with fever. He was a child. So he having the fever so much that he cannot move also. But he is having tomorrow exam. He is having tomorrow exam. So with this fever also he get it up and he practiced for exam. So I asked, what made you to practice for exam? He said that if I get good marks, I will get so if I do this, I will get this. It's all about the business. So I given him Bryonia 200. It works beautifully. The fever came down and he became active also. So this was the mindset of the patient. So when we think about the business also, we have to think what they are dealing. So
Yes.
they're doing with the emotions, whether the business is with material things or business with non-material things. Like non-material in the sense the emotions. Material means like buying this, buying that, and keeping some amount like this. So these all calculative things comes into play in material things. But non-materialistic business is like emotional. So in this way also we can think when we are dealing with the patients.
Yes. I think especially when we deal with pediatric child cases, this is the way to go about.
Yes.
Yes.
So what else about this? Uh, any any experience of you where you are sticking to particular area and how the search case taking is helped you to go further in that area.
So actually, whenever we speak about the area, first in starting of the case, we will explore the whole physical symptoms. Then, when the
Correct.
patient goes deeper into emotional and delusion state, various areas will come. But
Hmm.
in most of the cases, we can see whatever the patient speaks in one area, the other area, the commonality will also come. So, in one of the
Correct.
cases, we can see in the starting stage in her family life and everything, what she spoke was, I should get my, I should build a house. That is my whole dream in my life. In the starting area,
Hmm.
she spoke. One of the patients spoke to me like this. And this house I will build on my own. I know I don't want to depend financially on anyone. So this is what she spoke.
Okay.
And even in my old age, I don't want to depend on my son for money.
Hmm.
Let him use the money whatever he is earning. And I know what work I am
Okay.
doing and I know what I am doing now. So whatever things needed, I will do on my own. This is her one area which she spoke. And the same thing in the fear also we can see. Like what she spoke was, I should build a house within my lifetime. That is the fear.
Okay. Hmm.
I want to build the house. Because if I didn't build the house, I don't have the stability in life. Because I am running the business. So
Okay.
I'm fear about whether I will be unable to build the house within my lifetime. The same also we can see in her.
So,
I wanted to, like I have built the house and I'm entering into the house. So we can see the each and every areas when we explore deeply, we can see the commonality covering in every areas. So in this
correct.
patient, she wants to be independent. She is not dependent on anyone. And she knows what she wants to do.
Hmm.
She wants to build the house. And even in her old age, she doesn't need the support of her son. She wants to be stable by herself. She takes her
Okay.
own business. She is running her own business. So she knows what she is doing. So with this team covering everywhere, I gave her Ceramide and that for her
Okay.
complaints of parotid inflammation. So that worked her very well.
Mm-hmm.
And her parotid inflammation came down within 10 to 15 days. And another doctor said, how this got cured because we too don't know how to treat this.
That's the
Nearby
beauty of
doctors
homeopathy.
said, yes, we might not be able to cure
So,
this condition. So this is how in the areas we can see each and every area when we explore deeply. So we can see the commonality covering in every areas.
correct, correct, correct. So, that's the difference between the Calcarea mother and the Ferrum mother.
Yes,
So, where Ferrum mother handles everything in the home, where Calcarea mother just only the safety, security of family members. That's it.
yes,
Whereas Ferrum, externally anything is coming or internally anything is happening everywhere, he handles the very wisely the situation,
yes,
whether in food, food issues or financial issues and anything externally and internally in the home, the Ferrum lady handle very wisely.
yes. Very well. If we see Calcaria mother, they will tell that in old age I am dependent on my son. My son provides me the money. But if we see in Ferrum as they are developed, they don't want to depend on their son in their old age.
Yes, correct. Correct.
So
True,
this
true,
is
true.
how they are.
So this is how the remedies and few cases where when patient talks about the money, how to differentiate the remedies and how to see the different shades of persons, how they talk about the money we have discussed.
Yes. And I think upcoming seminar in Hyderabad on August 25th will be an amazing learning journey with Dr. Shekhar sir. And on behalf of you, I invite all college students, especially, and all the practitioners to attend this seminar and to get the benefit out of this. So our journey started
Yes,
from
yes.
my journey started from third year. So it's the right stage for college students, those who are in third year, final year internship, to start their journey with SaaS teaching and where they can see a massive change in their all the aspect of their life. So it's a must attend seminar for those who are in and around Hyderabad. It will be of much beneficial.
Yes, yes. You should not miss this opportunity because sir going to explain about different remedies and their artistic way of understanding the remedy is sir clearly explains us. So it will be like a imprint. And there sir also explains about differences between the remedies. When in particular rubric, when remedies are coming from three different kingdoms, plant, animal, and mineral kingdom, how to differentiate their kingdom characters with the kingdom common symptoms, how to see that peculiar remedy character. So that is beautifully sir going to explain in this upcoming seminar. And not only about remedy, but case taking aspect, where sir teaches when person is talking about particular area of their life space, then how to frame a question, how to take the patient further towards the simlimum, and it makes easy to select the simlimum. So these are going to happen in upcoming seminar on August 25th. It's on Sunday. Don't miss the opportunity.
Yes, very true.
So
No one should miss this opportunity, those who are in and around Hyderabad. And SAR's teaching, as Bhanu said, SAR will explain the case taking process for the cases where which SAR is showing to us. But those process which will not only help us in our case taking aspect to develop, but also in the day-to-day conversation with the people whom we meet.
yes,
In that
yes,
process also it will help. So I must attend
correct.
seminar on August 25th. So my dear homeopathic friends, don't miss this opportunity on August 25th on your way.
Hmm. Okay, ma'am. Then it's nice talking to you, and nice to hear cases, all your experience regarding these aspects of case taking and money aspect, financially, how remedy talks, how deal. So it was beautiful conversation between us, and thank you so much for coming to us
Thank you
in
so
live.
much, Bhanu. Thank you so much for this opportunity. And it was a good conversation, I felt. We discussed many cases.
Yes, yes.
Yes. And this is our clinical
Thank you,
experience. And
ma'am.
thank you. Thank you so much.